Diabetes. In this session, we are not going to discuss more about the theory, but about the practical aspects. If at all I am not heard, or if at all the slides are not moving, please let me know.
Sure, ma'am.
So in this session, we are going to learn about the following things. That is the disease, what it is in Ayurveda, what are the types of it, Ayurveda treatments and prevention and control, and disease complication as well as conclusion. So we'll be learning these things in step by step. The disease diabetes. As so many of us are practicing already, so everybody knows what is diabetes. But why are we discussing about this diabetes? Because we are seeing a lot of incidences of diabetes. This is what I'm going to tell you about the incidences and what it is. Diabetes mellitus is a group of metabolic diseases. So this part we are supposed to know because this is not a single disease. It is a group of metabolic diseases characterized by hyperglycemia resulting from defects in insulin secretion, insulin action, or both. So why this happens? Why the blood sugar level increases? Either the body is producing or the pancreas is producing the less insulin, or whatever the normal amount of insulin is produced, it is not utilized by the body, or both. So this is when a person lands up in diabetes. This everybody knows, but let us refresh the things. Chronic hyperglycemia is increased in the sugar level, is associated with long-term damage, dysfunction, and failure of various organs. So either it causes a mild damage, or it totally causes dysfunction or total damage to the various organs, especially the eyes, the kidneys, the nerves, heart, and the blood vessels. So when we practice, we get different varieties of complications related with these organs. So diabetes leads to either the dysfunction or the failure of different organs. Global diabetes epidemic. So the globe or the whole world is going to be diabetes epidemic. Epidemic in the sense large group of people are going to suffer from it. So global incidence and prevalence is 10.5% of the adult population, that is between 20 to 79, has diabetes. This is according to year 2021 census. Almost half of those with diabetes are undiagnosed, because not always, usually what happens in our practice is we miss the diagnosis of diabetes, or few people do not come to a doctor and they don't know that they are suffering from diabetes. So almost half of those, so whatever I told, the 10.5% of the population is suffering from the diabetes, where half of them don't know that they are suffering from diabetes. So the WHO says maybe by 2045, 1 in 8 adults, that means to say about 783 million people will have diabetes. So this is alarming. And we, being the practitioners of Ayurveda, can contribute a lot to preventing the disease. So 1 in 8 adults may suffer. So 2045 is still far. We in group can do a lot of difference. This is why today's class. So 46% globally, I'm talking about worldwide. So if at all we talk about India, India is a major hotspot. So we are not only
Excuse
increasing.
me, ma'am.
Hello?
Ma'am, kindly recheck the slides, ma'am. It's still in the first slide.
It's in the first slide.
Yeah, ma'am. We are displayed with the first slide.
Okay, I'll stop sharing and again I'll start sharing. Okay.
Okay, ma'am.
Can you please tell me we are in which this one slide?
The disease, first slide, ma'am. I mean, number 1, the disease diabetes.
Okay, now
Diabetes mellitus, a metabolic disorder slide.
whatever I explained now, okay. Okay, so you people thought without the slide I was explaining. That's okay. So this is what I explained, diabetes mellitus, a metabolic disorder. Okay, I think I may not have to repeat this, right? Do you want me to repeat this?
No, ma'am.
Ma'am, just,
No.
yeah.
What? Do you want me to repeat this?
Yes, ma'am. Just give a glimpse of every slide, ma'am.
Yeah. Okay. So what I told you was that in this class, we will be discussing about the disease. That means the disease diabetes and what it is in Ayurveda, what are the types of it, Ayurveda treatments, prevention and control, disease complication and conclusion. So this is what we are going to discuss in this class or in this discussion. So the disease, as everybody knows, we are going to discuss about a lifestyle disease called diabetes mellitus. This is a metabolic disorder. So this is not only a disease, it is a group of disease which is caused due to improper metabolism. And this is caused either due to improper secretion of the insulin or improper utilization of the insulin or both. So when the pancreas, when the body is unable to process the sugar that is available in the blood, the person lands up in hyperglycemia, or it is called as diabetes. Chronic hyperglycemia or diabetes is associated with long-term damage. This is what I explained, that it causes the dysfunction or failure of different organs like kidneys, nerves, heart, and blood vessels. Can you see the slide moving now? Whether the slide is moving now? Hello?
No, ma'am.
Again, it's not moving?
Yes, ma'am.
Which slide are you seeing now?
Diabetes
Ma'am, it is
mellitus,
same.
a metabolic disorder.
Again, it stopped. Now?
No, ma'am.
Ma'am, kindly put it in the slideshow, ma'am. Then we can check it, ma'am.
I am putting it in the slideshow only.
Full screen, ma'am.
Yeah, full screen. Yes. Yes. I have put it in the full screen. I'm doing the slide share.
Ma'am, just disconnect again and reconnect the slide share.
Let me check first whether everything is moving. Whether it is moving now?
No, ma'am.
No,
No?
ma'am. Uh-huh.
Why? Yeah, let me check now. Whether it is moving now?
Now it's in full screen, ma'am. Yes, ma'am. It's now moving.
Wait.
Slides are changing, ma'am.
Slides are changing?
Yes, ma'am.
Okay. So if anything happens in between, let me know. Again, I'll disconnect and then I'll share. Okay.
Sure, ma'am.
Yeah. So we were talking about the global diabetes epidemic. I was talking about India, a major hotspot. We are not only increasing in population, but we are increasing in almost all diseases, and diabetes is one of them. About 11.4% of Indian population has diabetes, and 15.3% may have prediabetes. It is may have prediabetes because many of them do not approach the healthcare system. So we don't know. So it is may have prediabetes. Why we should know about these things? Because once we know about these things, maybe we frequently check about the diabetes. Many of the times, it is not like the textual symptoms that appear in a patient. So if we know that we are going through a diabetes epidemic, or we are being Indians, we are going through a major, we are becoming a major hotspot of diabetes, even with the different symptoms, you will be having that awareness that, okay, let me check the sugar level. So to know the depth of the disease, or to know how seriously we are going towards this disease, is more important, because we will check it frequently. Being in a healthcare system, we should be aware that how many types of or how many varieties of diseases we are suffering from and how frequently we are suffering from. So this incidence and prevalence makes an important thing. So India is a major hotspot. So next, whenever or whoever comes to your clinic, never fail to. So don't just think that it is some other disease. Just go for a blood sugar level check so that if at all you can detect one or two, that will be a great thing. What is Ayurveda perspective on diabetes? So when we say Ayurveda perspective, whether diabetes is whether the diabetes is Madhumeha, we get a question mark. So it is a group of metabolic diseases. So we can take it as a question mark Prameha. Can we take it as a Madhumeha? Can we take it as a Medho Pradoshaja Vikara or all of the above? So since it is a metabolic disorder and there are n number of symptoms that a patient presents, we cannot stick on to Madhumeha alone. No disease in Ayurveda is equal to a allopathic disease. So whoever or whichever the patient that you see, you cannot exactly say that Madhumeha is equal to diabetes or diabetes is equal to Madhumeha. We are supposed to talk or we are supposed to think in a higher spectrum. That is, it can be Prameha, it can be Madhumeha, it can be Medho Pradoshaja Vikara or all of the above. Why it is Medho Pradoshaja Vikara? Because Medho Pradoshaja Vikara leads to Ashtavida. Ashta, can anybody tell me? It is either it leads to Prameha or Ashtaunindita Purusha. So Medho Pradoshaja Vikara causes Sthaulya also, and Sthaulya in due course of time lands up in diabetes. Why it is Madhumeha? Because there is a sweetness in the urine, and also there are maximum number of symptoms which is similar to the diabetes. Why it is Prameha? Because you also see different involvement of different doshas in the diabetes. If I say the contemporary science as diabetes, and if I say Prameha in Ayurveda, why we can compare that? Because we see that the Prameha or the diabetes has different dosha involvement. So we can take it as Prameha. So multiple things are compared, or we can compile the Prameha, the Madhumeha, the Medho Pradoshaja Vikara into diabetes mellitus, and we can treat it like that. So diabetes mellitus is not only Madhumeha, it is Prameha, it is Madhumeha, it is Medho Pradoshaja Vikara. Whether the slide is moving now?
Yes, ma'am.
Yes. Purva Rupa and Rupa, this everybody knows, but still I would like to refresh it. Svedo Angagandaha. Yes. What? Svedo Angagandaha, excess sweating and smell in the body. Shithilangatacha. Shithilangata is, it's like there is no much strength or the feeling of anxiousness in the body. Shayyasana Swapna Sukhe Ratischa. Always want to relax, always want to enjoy. No work at all. Rudnetra Jiva Shravanopadeho Ghanangata Kesha Nakhati Ruddhihi. This everybody knows about it. The symptoms are there. Shita Priyatvam. So when you see this, there are maximum. This is considered as Purva Rupa and Rupa of Prameha. They have not told it as Madhumeha. But when we look into diabetes, we get all these things. One patient, if they complain about the dryness of the mouth, the other patient will complain about excess sweating. The one more patient will say that they are lazy. So this comes under Prameha. Shita Priyatvam Galatalu Shosho Madhurya Masyam Karapadadahaha Bhavishyato Meha Gadasya Rupa Mutre Abhidavanti Pipilikashcha. After explaining everything, later he says that Mutre Abhidavanti Pipilikashcha. The ants crawl near to the urine because the urine becomes sweet. So the person will have all the symptoms. The symptoms of Prameha later lands up in Madhumeha. So everything is diabetes mellitus. why we are landing up in diabetes mellitus, or why there is lot of increase in the case. Food. So why food? Because we eat food which is not at all healthy. Nowadays, we don't go through the process of preparation. We just need the fast food, which is very easy to prepare, and it should fill the stomach. And we are going behind the tongue. So whatever that satisfies the tongue, that is the best food that we think about. But there are a lot of problems that we are facing because of the food, and I don't think I need to explain, but few things that I'll tell you, that is the fast food or the junk food. The intake of bread has become more frequent. The people from other country, they also eat bread, but they don't have this many incidences because they have bread which are prepared from different ingredients. But here in India, we prepare it from maida, or we prepare it from multigrain, which they say that multigrain, but which contains the maida or the refined flour. So because of that, we land up in diabetes. Also, we are not at all following the timing. As per Ayurveda, we have two annakalas. We are supposed to eat only 2 times a day, but we don't do like that. Now, whenever the food is available, we eat it. And nowadays, trend is midnight snack. That means even at the night, mid of the night, if you feel like eating, you can snack around. So this is the trend. Whenever the trend changes, it changes both in positive and negative way. The food is available, that is good, but the negative effect is we are landing up in disease, and that too, even youngsters are landing up in diseases. So food has to be modified, and this is just a few examples that I gave. I don't say that being South Indian, I don't say that only idli dosa is a good food. Whatever the food that is available in your place, whatever your ancestors were eating, that is supposed to be the best food. Whatever the food that is available is the best food. Nowadays, we go behind the fruits which are not grown in India. We feel that those which are imported are very nice food, or the say for example oats is not at all an Indian food, but we feel that it's very good. So like that, we have modified a lot of things in food. So I think whenever a patient of diabetes comes to you, I think you're supposed to talk more about food and lifestyle. How about lifestyle? We lack exercises. We don't do anything physically, because nowadays, in olden days, everything was done physically. Say, for example, they used to walk to a store to bring something. Now we use two-wheeler or four-wheeler, and they used to do all their activities with physical thing. Like that means they used to wash their clothes. They used to grind everything. But nowadays we have mixers, we have washing machine. The more the invention is, it has harmed our health in different ways, and diabetes is one of them. I don't say that the food and the lifestyle causes only diabetes. Since the topic is diabetes, my intention is more on the diabetes, but it causes a lot of lifestyle diseases, and one of them is diabetes. Stress, that better not to speak about it, because maybe few of you have attended the classes. Now maybe the few of you are attending the class and you will be thinking something else. You are so stressful that at what time it is going to end, and next what I'm supposed to do, or what I have not done. So a small stress and a bigger stress, which is going to land up or cause many diseases. As I said, these reasons causes different diseases, and diabetes is one of them. Our role. So we thinking that everybody who is attending this class is a hardcore practitioners of Ayurveda, and they believe that we can do a lot of change in the society. Thinking that, what I would like to say is we can do lot. As I said, 2045 is still far away from us. So we can really change the way we are seeing our nation. Educate about the diet. Being a Ayurveda practitioner, you should know which is a good diet, which is a bad diet. I know whatever you say, the patient may not follow, but I think even if you could, after giving a lecture for 100 patients, if you could change one person, that is really a great thing that you can do. Educate patients or educate the people about the diet, promoting awareness about balanced diet. I'm telling about balanced diet because nowadays the trend is about protein diet, no carb diet, or low carb diet. We do not believe in divided diet. We believe in Shadrasatmaka Ahara, where each rasa is dominating in Panchamahabhuta. Each Panchamahabhuta helps us in rejuvenating our body. Hence, we do not concentrate on this protein, carb, such type of diets. We believe in Shadrasatmaka Ahara. Please promote Shadrasatmaka Ahara rather than don't tell them that reduce this much of carb, increase this much of protein. Don't do that. So go through the textbooks again, go through the food again, and teach your people about the diet. Promote yoga. Now the whole world knows about yoga. Why yoga? It is not that I'm promoting yoga because our Prime Minister is promoting. Yoga is an important thing because yoga not only tones up the body, it keeps your mind very calm. Yoga chitta vritti nirodha. It helps in calming down your mind. It helps in de-stressing your mind. And also it just tones up the body. So if you search about the difference between the yoga and the gym, so it is said that yoga tones up the muscle, whereas your gym tightens the muscle. So when the muscle tightens, you get that shape and all, but body doesn't function in a way the toned muscle can function. So it's always better to promote yoga, irrespective of which whatever that you believe in. Yoga it is not religious. It is just a beautiful thing given by Indians to the world, and don't feel shy to promote it because it is for their health. Lifestyle modification. So lifestyle changes, that is in pre-diabetic condition. So when the sugar level is low, that I'm going to discuss later. In that, don't prescribe medicine at once. Go with the diet, go with the yoga, ask them to do some lifestyle modification. You can see lot of changes. I'll share my experiences in next slides. Opt Ayurveda. So being a Ayurveda practitioner, have a hardcore belief in your medicine because it avoids lot of complication. Prioritize the prevention. So you have to give priority to prevention rather than curing, because whatever we are seeing in contemporary science is they are trying to prevent they are trying to reduce the sugar level, but nobody is thinking about why we are getting this many patients of diabetes. So we can do a lot of things in preventing the disease. Everybody is behind controlling the blood sugar level, but not thinking about reducing the incidence of diabetes. This we can do, I think, a lot of things. Where to draw the line? That doesn't mean that everything you can treat. You should know clearly that which you can treat and which or who or which patient you're supposed to refer to the higher center where they can adopt allopathy. Let's not ashamed. We are supposed to do our part. They are supposed to do their part. If you are referring some patient to somebody who knows better than you, is not at all a shame. It is like you are helping one life to lead a better life. So please refer if you feel that you are not unable to treat this. So you should have a clear-cut idea that up to which sugar level you are going to treat, and after that you are not going to treat. So if you have that clarity in mind, you are going to treat in a better way. So I'm going to discuss 3-4 unique cases where diabetes was not expected, but it became a diabetic patient. It was a diabetes. So I got a case who was a male aged 38 years, and he was a bus driver. He came with a complaint of right shoulder pain, which is disturbing his day-to-day activity. He took medication from orthopedician. There was no reduction in pain. So this guy was on the orthopedic treatment for maybe more than 3 months, but the pain was so disturbing. The X-ray of the shoulder was taken. It was So depending on the X-ray, the painkillers were given, but there was no reduction in pain. I just checked his blood sugar level and it was 300 plus. So when only the medicine for diabetes was given, or when I advised the diet lifestyle to each and everybody, whether they are a diabetic patient or somebody else. But when that was done, within 15 days, his shoulder pain reduced. So this is a unique case. So tomorrow when you get a patient with shoulder pain, just have a thought that this may be also a possibility. I don't say that all the patients who are having shoulder pain will have this, but if at all it is not reducing with your primary treatment, just have a thought that this can also be a possibility. And nowadays, age is not a barrier. You can test sugar in everybody because we are leading such bad life. The second case, the female aged 60 complaining of severe itching all over the body. She had skin rashes, red rashes, and she took medications for skin disease for a long period of time, maybe 6 to 8 months. Exactly, I don't remember. It's a long back case. So maybe 6 to 8 months she took medicine, and whenever she took medicine, the rashes increased. So she did not get any relief in her skin disease. So she changed the doctor. Obviously, doctor shopping is a common thing that we see in India. I don't know about other countries, but here we do a lot. But there was no reduction, and hence she landed up here. I checked her sugar level. Again, it was too high. Only the sugar reducing medicines were given, and she became very well within 15. She responded excellently to the skin disease only with the medication for diabetes. The third case, 12, this is why I told, do not think about the age. Nowadays, age is just like you can test sugar level in any age. So a 12-year-old excess urination, and many of the times it is bedwetting because 12-year-olds never do bedwetting. He used to have a bedwetting, sometimes burning micturition, and hence the sugar level was checked. He had a habit of drinking the soft drinks like Coca-Cola, Pepsi from the very young age. He landed up in increased sugar level. Unique case number 4, a female aged 52 came with a complaint of loose stools since 1 month, and no medication could stop it. And I checked the sugar level, it was 520. I cannot forget this case. The exact amount of sugar that was there, it was 520. She just came walking without any problem. She just had a complaint of loose stools. That was the only complaint. And just because no medicine could cure it, I just thought of testing a sugar level, and it was 520. So these small cases I'm telling you because you people are the practitioners, and there are very unique presentations. Never think about the cost, just go with the sugar level. What we get it in classical textbooks of Ayurveda, this everybody knows, but let me refresh a bit. Dvau pramehau bhavataha. So if you can see here, when he says prameha, he says there are two types of prameha. He has not told about madhumeha. But when we say about diabetes, we say that there are two types of diabetes, type 1 and type 2. Dvau pramehau bhavataha sahajau apatya nimittascha. One is sahaja and another one is because of our apatya ahara. Tatra sahajau matru pitru bija dosha kritaha. So sahaja is by birth, or you can call it as type 1, where there is a problem with genetics. So it is a genetical problem. Ahitaharaha jo apatya nimittaha, the one who takes improper diet, that is a type 2 diabetes, which is due to apatya nimittascha. So tayo purvena upadhritaha, the first one, that is the sahaja. Krisho, the person will be lean. Ruksho, the person appears where the skin will be very rough. Alpashi, he eats very less amount of food. Pipasu bhrisham, he will have lot of thirst. Parisarana shilascha bhavati, he walks a lot, but still he'll have the increased sugar level. Because when a person walks a lot, Automatically we feel that his sugar level should be low, but that is not a case. If it is due to Sahaja, he will have these many symptoms. Uttarena, the second one, what we call it as type 2 diabetes, Sthulo, he will be obese. Bahuvashi is he eats a lot. Snigdhaha, he takes a lot of unctuous thing. Shayasana Swapna Sheelaha Prayeneti. Usually when you say they are the lazy bugs, we can say that couch potatoes, they will love to sit, they love to enjoy. Usually they are considered as type 2 diabetic people. Why I told this shloka? Because I told it can be prameha, because here dvau prameha. When you say prameha, he has told about three types of prameha: vataja, pittaja, and kafaja. But when he explains in different conditions, he says that there are two varieties of prameha: sahaja prameha and apatya nimittaja prameha, which we can directly compare it to diabetes mellitus. So what are the types? Sahaja, we can consider it as a type 1 diabetes. In such cases, it is always better to test C-peptide. So now I'm talking only about practical things. See, now you know the theoretical aspects because you are practicing people. What we should do? So type Sahaja. So when you see the patient or when you take the history of the person, you will understand that this is type 1 diabetes. Always go for the test called C-peptide. C-peptide says that how much insulin production is there. Okay. If the test is lesser than the normal range, then refer the patient to the higher centers or allopathy people because insulin production is not proper. They need external insulin. If it is in the normal range, then take the patient, you can do better. So C-peptide is an important test that has to be done. Then, if the production of C-peptide is normal, then we can treat and it is treated as type 2 diabetes. What we are going to do? So, what is our target? Our target is to, what is our target? Our target is to reduce the blood sugar level as well to restore positive feeling. Whenever a person suffers from any disease, I'm talking about the diabetes. So, if at all you tell the person that he is suffering from the diabetes, the diabetes sits on his head. He'll be always thinking that, okay, I'm diabetic, I'm diabetic, I'm diabetic. Such stress again will increase the sugar level. Allopathy people, they reduce the blood sugar level, but we have a positivity. We can reduce the blood sugar level. Also, we can restore the positive feel. That is what we can do. So, and how to approach that? Approach is very simple. Address the Agni, check the Sadhya Sadhyata, categorize the doshas, and treat through either Shodhana or Shamana. This is what we are going to discuss now. Why Agni? So, Agni, we know that if there is an involvement of Agni, there is Ama, and Ama causes different diseases. This is what we have learned in our slides in the class. So, what is Agni? According to recent study, free radicals and oxidative stress play an essential role in the development of type 1 and type 2 diabetes. You understood? Agni or Ama, we consider it as a free radical and oxidative stress. So, free radical, the concept of Ama was there long years back. Now they say that oxidative stress and free radicals are the reasons for type 1 and type 2 diabetes. So, we are supposed to improve the Agni for all the patients with diabetes mellitus. Some will have Mandagni, some will have excess Agni. What we are going to do is we are going to normalize the Agni. How we are going to normalize the Agni? So, to enhance the Agni, we are going to we get lot of things. So a few I have mentioned that it can be tablets, kashayas or churnas like Chitrakadi Vati, Agnitundi Vati, Chitrakadi Kashaya, Chiruvilvadi Kashaya, Trikatu Churna, Panchapola Churna. This I cannot say that you should give this because each patient is different and you should use your intelligence to select what tablet has to be or what kashaya to be given or what pana jala to be given. So it totally depends upon your intelligence. These are the available things to increase the Agni. If Agni is already increased, give certain stuff which is very hard to digest so that it becomes normal in thing. So this is how you are going to enhance the Agni or normalize the Agni. Then you have to go for Shodhana. This is what Acharya says. Tatra sadhyan pramehan samshodhana upashamanair yatarham upapadayam chikitsa deti. So if at all the person is arha, if he is interested, then go for Shodhana and then followed by Shamana. It is not easy to adopt Shodhana. But if at all, okay, you're also interested, patient is also interested, patient is eligible, then we can go for Shodhana. In Shodhana, the first thing that comes is Snehapana. So which are the Gritas that you're going to select? That totally depends upon whether the person is lean, whether the person is hefty, whether it totally depends upon so many things. But few things that I can give example is Gugulu Tiktaka Grita, Pancha Tiktaka Gugulu Grita, or Vidaryadi Grita, or if nothing is there, Indukanta Grita, these things you can give. But how many days you are going to give Snehapana? As you people know, Snehapana in Prameha is not so much indicated because already there is the Abadhamedas that is there. So we cannot increase the Snigdhata more. Nati Snigdhan Virichyate. Na Ati Snigdha. So you can fix the days, 3 days, to the maximum 4 days. Better is to give for 3 days so that no much Snigdha Lakshana comes. Whenever we adopt the Shodhana or Snehapana treatment, we expect the Snigdha Lakshana. But in this case, in Prameha, there should not be much Snigdha Lakshana. Na Ati Snigdhan. So you cannot expect all the Snigdha Lakshanas. With that, you can stop the Snehapana. After Snehapana, go with Snehana and Swedhana. And then see whether the patient is eligible for Vamana or Virechana. Go with Vamana or Virechana. Then go for Santarpana. Keep in mind about Agni. So you should know what type of Agni he has. Then Santarpana to be done. Santarpana in the sense, if the patient is having, if the person is Krisha, go with Santarpana. If the person is Staulya, then go with Apatarpana. But Gurucha Atarpana, where the food is heavy, but it doesn't cause too much of Apatarpana. I don't know how much you understood, but let me explain step by step in next slides. If Tatra Sadhyan Pramehan Samshodhana Upashamanai Yatarham Upapadayam Chikitsedeti. So after the Samshodhana, you can go with the Shamana depending upon in what position the patient is. So if the person is Samshodhana Anarha, if the sugar level is too high and if you think that he cannot withstand the Samshodhana, don't go for it. Go for Shamana. If the patient is not interested, do not force the patient to go for Shodhana. Go for Shamana. Practicability. See, I told you, everybody, the time is very precious. So everybody is in hurry. No, many people cannot spend 8 to 10 days in hospital. So if they are practically not possible, go for Shamana. Before we adopt these type of patients, we have to categorize the patient into following categories so that we can give a tailored Ayurvedic intervention. Pre-diabetic, newly detected diabetes, Ayurveda seekers already on allopathy medicine with complication, insulin dependent. After considering all these things, we are going to plan the treatment. Our Ayurveda medicine is never like give this, the sugar will be fine. No, that is not possible in Ayurveda. So it is a tailored one. Each patient is different. Each condition is different. So the medicine that you select is also different. That depends upon all these things. Let me give 1 or 2 examples for these things. So if the person is pre-diabetic, when do you say the person is pre-diabetic? It is FBS between 100 to 125 or HbA1c between 5.7 to 6.4. But to me, I do not give any medicine if the FBS is 200 or RBS is up to 250 mg per dl. Till that, I consider them as a pre-diabetic and I never prescribe any medication for them. To them, strict sugar-free diet is advised. Sugar-free diet, if the sugar level is 200 to 250, sugar-free diet in the sense not even the fruit sugar is advised. So it is totally cut down on the sugar intake, including the fruit. But if it is 100 to 125 FBS, the fruit is allowed, but other excess sugar is avoided to be avoided. And regularity in food intake. Why the regularity? Like if the person is having breakfast at 8 o'clock, 1 o'clock lunch, and the dinner by just before sunset, maybe 6, 6:30. That is what I do, and I ask the persons to do. The regularity in food intake and physical exercise at least for 30 minutes. 30 minutes is not enough. To begin with, 30 minutes is enough. Increase up to 1 hour. Restricted diet. You should give a diet chart. So, diet chart, I cannot say that you have to give this and this. If you are a North Indian, maybe paratha is more satmya. If you are a South Indian, maybe dosa, idli are more satmya. So diet also depends upon which place you belong to. Depending on that, give a strict diet chart. Newly detected. Say, for example, you are the one who detected the sugar level, mild hyperglycemia, where you detected it HbA1c up to 8 to 9%. So what you have to do? Again, lifestyle modification. Initial diagnosis and assessment. HbA1c is an important part because it shows the sugar variation for a long-term thing. Like it tells about the sugar variation. It is said that for 3 months. So that is a better thing. Just a second. Lifestyle modification like low glycemic index diet, portion control. A large amount of food if the person is taking, just reduce the quantity depending upon the Agni. Regular physical activity, stress management. As I told you, yoga and meditation. And if you believe that this person is not going to, because nowadays, if our doctor sends the patient without medication, they don't really like it. They feel that this doctor doesn't know. That's why they are not giving the medication. So you can select a very milder medications like insulin and diabicon, which I get here. Whatever the minimum level medicines that you get in your place, that you can use it. If at all you feel that the person is not happy because you are not giving the medication. If I detect it, I don't give medication for 15 days. I just tell at whatever level the sugar is, I just tell them all the restrictions and ask them to come again after 15 days, check again everything. And if it is undergoing control, I'll just ask them to continue the same thing without medication, how much possible that I see. But if I see that the patient is not going to hear, because when you are confronting the patient, you will understand that whether they are going to hear you or not. This is a very uh, this comes with the experience. So if you see 100 patient, the 101 patient, you will understand that whether this guy is going to follow your thing or not. That is the easiest thing. So if you feel that they are not going to follow, put medicines which are very milder ones. Okay. Then newly detected, but the sugar level is little higher, where the HbA1c is 9 to 10%. Then strict adherence to dietary guidelines, regular exercise, stress management techniques. Maybe if needed, you can go with you can ask them to go for a counseling also. There is no, do not, you just have to tell the patient that it's not only the psychiatric patients go for counseling. Counseling can be any person with the stress can go for a counseling. Moderate medications like Kataka Kadiradi, Nisha Katakadi, or in conjunction with the Kashaya, you can go with tablets like insulin and diabicon. Okay. This is what I give and this is what I get here. Whatever the medicines you get here, that you can use, but you should know which is a milder one, which is a moderate one, and which is a higher one. So newly detected, but the HbA1c is more than 10%. comprehensive medical evaluation is must. See, doing the test is not at all an issue because you're using the medical engineering. So any test that you do, it is not the conventional doctor's property. It is just a development of medical engineering. So just utilize that. Have a clear-cut idea that what indicates what. So go for a comprehensive medical evaluation because HbA1c, if it is more than 10, it might damage the kidney. It might have already damaged the liver. It might have damaged the lipid profile. It might have damaged the eye. It might have caused a problem to the heart. So it should not be like just because they took your treatment, they had all these things. So before you prescribe the medicine, if at all the HbA1c is 10%, more than 10%, go with all the tests. When every test comes, explain the seriousness to the patient and then start your medication. Otherwise, there is normally people say that after taking Ayurveda medicine, there was a kidney failure. So it is not just to be on the safer side and just to make your patient on the safer side. Before starting any medicine, go with all the tests. Once you convince the patient, then go for a treatment. Always advise the patient to be hospitalized so that you can have a clear-cut monitor on their diet and then go with the Panchakarma therapies and use multiple medications to control the diabetes. Ayurveda seekers already on allopathy medicine. Nowadays, the trend is for a natural medication. So, just because they have come to you, don't get overwhelmed and say that stop all the medicine. I am capable of controlling the sugar level. No, you cannot because the body is already depending on a chemical-based medicine and body has stopped producing so many things and body has stopped utilizing the sugar. So do not stop any allopathic medicine at once. Along with their medication, start ours, monitor every 15 days, go with the blood test, then slowly reduce the allopathic tablet dosage depending on the blood sugar level. So do not say that I'll do wonders and I'll treat the diabetes. Do that. Okay. So insulin dependent to independent. A man aged 70 years came to the hospital wanting to reduce his insulin injection as he was injecting human mixture 30 units in the morning and 15 units every day since 3 years. And as per the reference of Charaka, Vyayama, Yogair Vibhidhaihi, Pragadhair Udvartanair Snana Jala Avasekaihi, Sevyatya Sevyatva Ela Agaru Chandana Adir Vilepanaischa Ashu Na Santi Mehaha. The same thing was adopted in this patient. Only the Agaru Chandana Lepana was not done, but Vyayama, food, Udvartana, Avagaha, everything done. And with help of above method, I was able to reduce his insulin. It's been a year now. He is without insulin and surprisingly, his sugar level never shoot up because he is a very obedient patient. He follows everything, whatever that I told on the day one. After maybe now it is already 1.5 years, he is following the same thing and his sugar level has not shoot up. He follows all the instruction that has been given to him. Diabetes complications. Diabetes can lead to a varieties of serious health complications, including eye disease, food problems, dental issues, heart disease and stroke, kidney disease, nerve damage, sexual dysfunction, skin condition. This is what the contemporary science says. I don't think I need to read this, but if you want me to read this, I'll read. Do you want me to read this? I think everybody knows about the complications. So these are the complications what the allopaths say. And these are the complications what Ayurveda people say. That is divided into Vataja, Pittaja, Kaphaja, and Tridoshaja. So whenever you are treating the complications of diabetes, because a lot of people come to you with numbness in the foot or burning in the foot, such type of thing, please categorize them think what complication it is or which dosha is involved in that complication, and based on the dosha, treat the patient. So if it is Vataja, Hridgraha, Laulyam, Anidra, Sthambaha, Kampaha, Shulam, Baddha Purishatvam Cheti, Vatajana. So if these symptoms are there, it is Vataja, Vrisha, whatever that the allopaths have told, same thing has been mentioned in Ayurveda. But when you treat it, it's a beautiful thing if you divide it into Vataja, Pittaja, and Kafaja. There you are supposed to address the complication by dosha base, not as a diabetes case. You have to maintain the sugar level as well as you have to treat the complication depending on whether it is Vataja, Pittaja, and Kafaja. And those which are Tridoshaja, which are said to be very difficult to treat, are Sharavika, which is called as the Prameha Pidakas, Sharavika, Kachapika, Jalini, Vinata, Putrini, all these things which are difficult to treat and it needs a different set of treatment. How to the management decide which category the complication belong to, Vata, Pitta, Kapha. Before treating, analyze that what you are supposed to give. Dosha-based treatment without disturbing the sugar level is indicated. So do not disturb the sugar level, but just calculate that which dosha is there. We can give Sahachara Baladi Kashaya, Vairyadi Kashaya, Gugulutikta Grita or Kashaya. Balarjuniya is one of the patent medicine that Acharya Sushruta Pharmacy prepares. This is an excellent medicine. It helps a lot in peripheral neuropathy. Brahatvata Chintamani Rasa, Shila Pravanga, Shiva Gutika. So these are the few choices that I have given. You can select depending upon the dosha involvement. General line of treatment. Adhyaha at first. Yavanna Vikritir Mantha Mehapaha Kashayascha. You have to advise the diet which is rich in Yava. And you should give some kashayas, meha paha kashayas, which reduces the meha. That type of kashaya you are supposed to give. Taila, Ghrita, Leha, Yoga, Bhakshaha, Pravara, Asava, Siddhaha. So there is a concept that you are not supposed to take ghee, but that is a wrong concept. If the ghee is prepared from the cow, which is not Jersey cow, so then Ghrita helps in rebuilding everything because Dhritam Pitta Anilaharam Rasa Shukra Ojasam Hitam. So it is capable of rejuvenating all the Sapta Dhatus, which is most important in diabetic person. So never say no to intake of ghee. Advise them to take a proper ghee. Nowadays, you can say it as A2 ghee. That is very good. Advise them to take it. It maintains the Agni level. It doesn't cause the excess Agni, but it maintains the Agni in a proper way. It rejuvenates the Dhatus. It helps in reducing the dosha. So that will be an excellent remedy for many of the diseases, including diabetes. Vyayamai vividha vidhaha. So different varieties of Vyayama to be advised. Snanan udvartanani gandhascha. This gandha or application is because they will be sweating more and they will be having a bad smell. So when they apply some good smelling agents, it gives the confidence in the person. That's why it is told. Udvartana. Instead of udvartana, it is always better. Mix oil in a kola kulathadi churna. That will not, it's called utsadana. That will not increase vata, but it reduces the vata and it is capable of reducing all the three doshas. Mehana prashamartam chikitsite dishta metavat. So this is how you are going to treat the prameha. This is a general line of treatment that should be adopted. So whenever the patient comes, you are supposed to advise the medicine, you are supposed to advise the yoga, you are supposed to advise the food. So this is what Acharya Charaka says. Millet. Now the trend is millet. Everybody is behind millet. So if you are suffering from diabetes, take millet. If you are having obesity, take millet. Where are we supposed to take the millet? So millet, they say that it is a trinadanya. It is pavana krita ullekhanam kapha pitta hrit. It increases the vata. It reduces kapha and pitta. So, if at all the person is madhumehi, where already he is suffering from vataja type of prameha, when you are using the millet, be be more cautious with the combination. So usually we ask them to boil it in water and take it. Don't do that. Millet is good, but it increases the vata. It increases the rukshata. That's why it is indicated in prameha, because it reduces the abadha medas. But if the person is lean, if the person is vata dominant, please advise them to take it with milk or with lot of ghee. Then it is capable of reducing the vata, and also it gives whatever the required result, that reduction in kapha and pitta. So millet can be given, but you should know whom to advise in which way or the preparation way. Points to ponder: prevention is better than cure, that we all know. Diet and exercise plays an important role. If medicine is must, then Ayurveda is the best. So if the medicine to be given, then go with Ayurveda. Changing lifestyle can change the life. So this is what. Thank you so much. And if you have any queries, if you are unable to ask now, you can mail me or you can connect me in LinkedIn. So thank you. I think I took 1 hour. If you have any queries or questions, you can ask me.
Thank you so much, ma'am. Thank you for detailing explaining the management of diabetes through an Ayurveda way. Now the session is open for question and answer. You can make it very fast so that we can finish it earlier.
If patient
Ma'am,
not
and some
wait, already
questions.
one question is there. Ma'am, if patient newly diagnosed with juvenile diabetes, which type of medicine to choose and which type of shodhana we can adopt? So it is like, if it is a juvenile diabetes, as I told you, first go for a C-peptide test, whether the production of insulin is there or not. If the production of insulin is not there, then you cannot take it. If the production of insulin is there, they can, whatever the adult medicines are available, that you can give it in a milder quantity. Do pre-diabetic patients often face anger issues as such? Pre-diabetic patient can face anything if they have a deficiencies. Okay. Nowadays, we have a lot of deficiencies like iron deficiency, vitamin D deficiency. So that lands up in anxiety and anger. And may not be pre-diabetic patient has this anger issue. Now anger issue is there in everybody. That shows that stress. That's why they are landing up in um, diabetes. Treatment for gestational diabetes mellitus through Ayurveda. Gestational diabetes, if only if you are confident enough, then go for it. Because if you are a gynecologist who are going to deliver the baby, then you can control it with your medicine. If not, do not take the chance, because no gynecologist allow the lady to take Ayurveda medicine, because they misguide them saying that this is not at all good for you. It can cause problem to the baby, and no mother is ready to accept that. So better not to go for a gestational diabetes treatment. Ask them once you deliver it, then come to me. I'll help you to prevent that. What about Krisha Pramehi patients that border on Shosha? Obviously, you can go with the Shilajitu, the medicine called Shiva Gutika, which is explained in the concept of which is, Shiva Gutika is a tablet which is explained in the concept of Kshaya. It acts as a rasayana, but is an excellent treatment for sugar also. So in Krisha Pramehi, you can go with that. More about diet. See, diet is a personal thing. The diet which is good for me may not be good for you. What the diet should be? The diet should be like, it should not cause stress to the patient. Say, for example, you cannot entirely 360-degree change you cannot make in diet. Whatever they are taking, just hear about it. Make a milder change so that it becomes more healthier, and advise them about the timing. So, diet is totally a personalized one. It's not that I don't want to explain you, but it is totally a personalized one. Ma'am, intake of rice should be restricted in DM. No, rice and wheat have a same sugar level, but glycemic index is little change. The wheat that get digested a little later than the rice. if they are following the proper uh, proper physical activity, then there is no problem in taking rice. But Shadrasatmaka is usually opted, and rice is a Madhura Rasa, so it comes under Shadrasatmaka Ahara, then you can take it. Can you explain us any treatment plans for Pittaja and Vataja Prameha? Because according to Charaka, it is Yapya and Vataja is Asadhya. Vataja is Asadhya. Asadhya doesn't mean that you should leave it. Asadhya, you can make it as Yapya. The medicine should be given continuously. Protein necessary daily in diet. Protein, this is what I said. The 0. I think 45 mg of protein is needed for per kg body weight. So if you are a 100 kilo person, 45 grams of protein is needed. So whatever our daily intake is, I think we are taking enough amount of protein. So there should not be excess protein to be given, because excess protein causes more pressure on the kidneys and you're going to disturb the balance. That's why the diet should not be based on protein, carb, etc., fat, etc., etc. It should be totally based on Shadrasatmaka or Panchamahabhuta theory. Jambu, Gudmar, Caravella, good result in DM. Yes, yes, they are good for this one. Chandra Prabhavati in initial stages, yes, of course, because this is a disease of Mutravaha Srotas. Obviously, Chandra Prabhavati helps. Chandra Prabhavati also has Shilajitu, which is capable of reducing the Abadha Vedas. Yes, it helps. In case of PCOD patient having UTI issues, giving Pramehahara Chikitsa is applicable. See, this is totally a modern concept. Do not diagnose the disease in allopathy and start giving Ayurveda medicine. Those people say that the insulin resistance medicines will help. Ours is a totally different concept of PCOD and different concept of diabetes. So do not mix with that. How to manage anti-diabetic medication during Snehapana? No need to give any medication during Snehapana, because Snehapana itself is very heavy for digestion. It doesn't increase the sugar level. If you have doubt, you can check it. In Nava Prameha to chronic Prameha, how to start or set? This is I told you in the class. There is proteinuria in GM already. So won't it hamper the system further when protein supplement? That's what I said. No need to give extra protein to the person. That is whatever protein that is available is enough. Nowadays, people are going behind protein. So if the proteinuria is there, cut down the protein intake, normalize the kidney function. Once the kidney starts functioning properly, then go with the normal diet. I think that is that the end of the questions? Any more questions? Whole of Arogya Vardhini Vati. If you see the ingredients, yes, Arogya Vardhini Vati helps. See, that is the beauty of Ayurveda. You cannot say that you should give this to this case. It is totally your intelligence, your patient, your patients, your patients, your diagnosis of dosha, and your set of medicines. So if you are confident enough, then go for it. There is a trend of dipping your foot in Betaka juice. I really don't know, because I'm not into the trending topics. I believe that whatever our acharyas have told, that is the best. So whenever I get time, I go with the studying our classical textbooks than the trending topics or the Instagram or all these things. So I really don't know about it. Sorry for that. So I don't know about practicability of that.
Hello, ma'am.
Yeah.
Ma'am, can we get your phone number?
I have 8277. It's my WhatsApp number. If I don't answer, please message me. I'll surely answer you. Because I'll be a bit busy in the practice, but don't worry about it. I will answer everybody's question. 82 doubles. I'll message here.
Okay, ma'am. Thank you, ma'am.
Oh, shit. I am unable to message. I don't know why.
Ma'am, actually the chat box has been closed, ma'am. We'll send your number to the participants in our group, ma'am.
Thank you.
Thank you, ma'am. From team, I'll receive the whole